So this is a soft tissue release exercise for people who get very tight or tonic or tense in their upper trapezius muscle. So the trapezius muscle is a sort of diamond-shaped muscle that sits on the posterior of the body in the sort of upper back to the neck area. It serves various functions for movement and posture. And what we often find is people get very tight, particularly in the upper trapezius, which is these little bits that sort of stick up out of the shoulder and connect into the neck. So I often perform this in clinic as a type of manual therapy where I sort of dig my hand into a patient's neck and get them to rotate. But the valuable thing is you can also perform this exercise yourself. So what you're going to do is take one hand, and I like to place it on the opposite side shoulder like this. And what you're going to do is just take, a couple of fingers, depending on sort of how much pressure you want, and just apply some gentle squeeze into the upper trap, the sensitive part that's quite tight and tonic. And it shouldn't be incredibly uncomfortable, but it will need to be quite firm. So about a 5 or a 6 out of 10 of discomfort at very maximum. You don't have to be shrieking with pain when you do this. And then you're going to rotate your neck to the other side. So here I'm applying pressure on my right side, so I'm going to rotate to the left. Nice and slow, nice and gentle. And what most people notice is that they reach a point where the tension suddenly increases a fair amount. So here I feel fine, fine, fine. When I get to about there, I notice these muscles sort of tense up and become a little bit more uncomfortable. So I'm just going to play with moving my neck into that range of motion. Like I said, it shouldn't be incredibly uncomfortable, but there will be some discomfort to get the benefit of the exercise. So you can perform this exercise as much as you like whenever you feel you need a bit of tension release in the upper traps. Make sure you do both sides so you don't develop any sort of unnecessary imbalances. But what a lot of people like to do is, if they have one side of their neck that's more affected or more tense than the other, they'll do the affected side first, then the non-affected side, and then the affected side again. I hope you found that useful. Try that soft tissue release. See if it gives you some release from any pain and discomfort you might be experiencing from muscular tension.